Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome to the second hour of News and Views on Salam Media. It is exactly 11 after 9 o'clock, and this is the time we welcome to the show our Polokwane listeners on One Nation FM. Let's just give you a quick rundown as to what you can expect in the second hour. Activist, lawyer, and writer Tasneem Fredericks is going to talk to us about being in solidarity with the people of Palestine. Ali Komape from Africa for Palestine is going to talk to us about the departure of the Israeli ambassador from South Africa. But first up, we are going to be talking about a new, exciting, novel concept. It's a disciplinary medical center right on our doorstep. So to talk to us about this is Dr. Imtiaz Dasoo, and let's hear more about it. Assalamu alaikum to you, Dr. Dasoo. Welcome to the program.
Alaikum salam wa rahmatullahi wa barakatuh. How are you doing?
I'm good, thank you. I'm very well indeed. You must be very, very excited. There's a grand opening tomorrow happening, as I've said, right on our doorstep.
Yes, alhamdulillah. After a long period of planning and lots of hurdles, inshallah, tomorrow we're having an open day, officially launching the medical center. As you mentioned, it's a multidisciplinary. We intend creating something different, multidisciplinary, holistic, comprehensive medical care. In an affordable, accessible environment to cater for people, across an economic range. As we know, economic conditions are quite tight at the moment, and we want to make sure that irrespective of people's economic status, that we try and provide an affordable service.
Subhanallah, that's wonderful news indeed. So tell us where exactly. I know I indicated that it's on our doorstep, and literally it is. And of course, it is going to be servicing a very huge area, is it not? Tell us exactly where it is, and then we'll talk about the different medical practitioners that are going to be servicing this unit.
So it's situated in Lenasia, within the Trade Route Mall precinct.
Wow.
Trade Route Mall now is developed into just more than a shopping mall. There's sporting facilities there. There's a huge residential complex within the precinct of Trade Route Mall. So we are located in front of entrance number 1, in the parking lot in front of entrance number 1, opposite the new pedal courts.
Okay.
So we're on the side where the taxis park on the outside of the
Right.
parking area, but we are in front of entrance number 1.
Okay. So this is a first for that precinct, the Trade Route Mall precinct, so to speak, and very especially since you say there's housing that's been put up in this precinct as well, and we know how huge Lenasia is. And what is very attractive about this facility is that there's so many different medical health professionals that's going to be housed in this one place, that you don't have to drive for miles from point A to point B to point C to go to different healthcare professionals for your different issues.
Yes, alhamdulillah, that's correct. So if I can just quickly go through the range of professionals who are going to be practicing there.
Of course.
So obviously there's going to be medical services, doctor, general practitioner, family physician, family medicine services. We encompass a range of diseases across medical and surgical problems for the whole family. That will be primarily provided by general practitioners and family physicians. And then we're going to have comprehensive dental services,
Mm.
We've got a full-time resident chiropractor, for particularly joint and skeletal issues. And then we've got a comprehensive rehabilitation service.
Mm-hmm.
So that will encompass the physiotherapist. The physiotherapist is also full-time biokineticist and the chiropractor in consultation with the doctor. Will be providing rehabilitation services, pain management, also in conjunction with the psychologist will be there full-time. We plan to provide emergency services, to fill the gap between the GP and the high-tech hospital casualties. That in between fractures that don't need to go to for theater, small cuts that require stitching, which if you go to a big hospital, you end up waiting 3, 4, 5 hours for 3 stitches. Patients who have asthma who just need a nebulization. So we intend bridging the gap. There's also going to be a speech and hearing therapy services. Speech and hearing therapist is going to be there full time. As I said, the psychologist, the emergency. There's going to be a lab on site, a full pharmacy, particularly focusing on provision of a streamlined chronic care service. People on with chronic diseases are struggling with their medications, and from both perspectives. One is on the supply side, and the other is on the other is on the compliance. Inevitably, sometimes human nature, we tend to become non-compliant our treatment when we feel better. And we're going to have a full X-ray service on site, occupational therapy as well. So it's really a wide range of services that we're going to be offering.
Okay. Are you planning? Alhamdulillah, that is really very, very comprehensive. In fact, I was just about to ask you about an X-ray department, and you've just actually answered that question. You preempted my question there. What about opticians and other healthcare providers going forward? Are you planning later on in the year, or as part of your long-term plan, are you going to be adding more services to the facility? How do you refer to it as? Is it a clinic, a facility? What is it?
Okay, so it's called the Trade Route Wellness Center, right?
Ah,
And
okay.
and it's powered by MedStar. MedStar is a company that establishes and manages and runs these multidisciplinary, holistic, comprehensive medical centers. And I just want to mention that the whole concept was the brainchild of especially Yasin and Zain Valley, who are the owners of Trade Route Mall, with a
Yes.
little bit of input from me.
Oh, wow.
And they saw the need for this, and they were instrumental in seeing that this project came to fruition. And we've worked quite well, and alhamdulillah, now we're on the brink of launching it, and we make dua that inshallah Allah makes it a success. So in terms of within we're right at the entrance of the mall. Within the mall, there are three optometrical services,
Okay.
that are already established within the mall. So we don't want to create unnecessary duplication.
Of course.
Because that's also actually a waste of resources. So it's literally a 1 minute walk from our facility, if not less, to the mall. I think to the first optometrist. So it doesn't make sense to have multiple practitioners within the same discipline in such close proximity. So that was one of the reasons we don't have an optometrist within the center, because it's literally less than a minute away.
No, it makes lots of sense, of course. And I must commend you guys. You're definitely big picture thinkers, forward thinkers, planning for the current situation, but also obviously 5-year, 10-year and beyond plans going forward. I do also understand that at the opening, you are offering free medical and health screening. Talk to us about it.
Okay, so Julie. So I don't know if you have the poster displayed on your
I do.
visual.
I do.
Okay. So,
I do.
so we're going to be providing free screening services, right? Health and screening services for people who may, who may not be sure about the existence of a health condition. You know, so the biokineticists and chiropractor and physiotherapists, who generally tend to work as a team, will be providing screening services for spinal problems, for patients with disabilities, for patients who require long-term rehabilitation, and then speech and hearing screening especially, and also medical screening, hypertension, diabetes, a little bit of screening from the psychologist who's actually quite busy, so who won't be available for all of the time, but there will be some screening services available for mental health issues, which are becoming quite prominent, and the incidence within the community is increasing, and we definitely need to address that issue. And our resident psychologist, Munira Ibrahim, will be on site, and she'll be available for consultation on a regular basis. And then we'll also have some promotion of some pharmaceutical items by certain pharmaceutical companies, giving information to patients about chronic conditions and how to manage their chronic conditions. Many patients are on treatment for hypertension, diabetes, high cholesterol, all of which are risk factors for vascular disease. So there'll be a comprehensive range of free health screening services that will be available tomorrow, inshallah. I just wanted to mention that one of the reasons that we planned and visit the establishment of the center is to fill this void for people struggling to obtain services at state facilities, and also medically insured individuals who are on hospital plans and are not covered for day-to-day outpatient services. And this is putting a real strain on them, and we really hope to provide these services at an affordable rate.
Alhamdulillah, you know what? As you were talking, my next question again, you've preempted. I was thinking about, when you visit doctors, and most doctors these days, are charging way above 3, 4, 5, and even more times above medical aid rates. And if you don't have gap cover, you're having to dig deep into your pocket to pay for those services. But of course, some of us are lucky that we're able to do that. But there are lots of people that aren't able to access, the extra funds to pay for the gap cover. And as you rightly say, lots of people are rather opting, because of affordability, opting for hospital cover, and then they don't have day-to-day cover. So what I'm hearing you telling me this morning, Dr. Dasoo, is that the medical professionals at this center are going to be very, very affordable. They're not going to give you a shock when they present the bill to you.
No, inshallah, we plan to, I mean, everyone has to earn a living.
Absolutely.
There are expenses involved in running a medical center.
Absolutely.
But we're not going to be contracted out of medical aids. We're going to be charging medical aid rates, right? And we will be accepting most, if not all medical aids, right? Including Discovery Key Cares and some of the lower plans who often struggle to obtain services from medical professionals.
Absolutely. A very noble gesture, a very, very noble gesture on your part, including, the Valley brothers and the Valley family for that matter. May Allah subhanahu wa ta'ala accept all of your efforts. May you be richly rewarded. Carry on. You did want to say something?
Okay. Yes, Julie. So, we also planning to establish a wound care clinic.
Wow.
So that residents of Lenasia, and I just want to mention, we're not catering only for Lenasia. We've got on the doorstep of the center, there are a number of informal settlements, Tembishitle, and then also the areas of El Dorado Park and Soweto. So there's a large drainage area which we intend servicing, so that residents in those nearby areas don't need to drive to all the way to Joburg now for this
Mm,
for these kind of services. And accessibility is crucial, because accessibility is
absolutely.
directly related to affordability. So
True.
there's a huge population that we intend to service, and we hope and pray that inshallah, we can provide a quality, affordable, accessible uh, service to all our communities.
I mean, as you're speaking, what's popped into my head is if you're saying, Alhamdulillah, that the medical services is going to be very affordable, you're accepting all medical aids without any, exorbitant medical charges, etc. You're very centrally positioned so people can access the services. I'm thinking that you're going to be growing by leaps and bounds, and your center may just not be big enough to cater for the hordes of people that will be coming your way. Are you planning for future growth?
Okay, so we currently have a two-floor facility.
Yeah,
All the current practitioners are going to be housed in the ground floor, and the second phase is the first floor, which inshallah should be ready for occupation within the first half of next year.
inshallah, Amin. Now,
And
the other,
and
carry on.
sorry, Julie, sorry to interrupt you.
No,
There
no
we
problem.
intend, we intend putting some specialists, especially specialists who can work outside a hospital setting. For example, gastroscopes and colonoscopy, which is becoming a very expensive service. Medical
Mm,
aids are not covering them fully, so we intend to do it, at a lower rate, because we'll have less expenses, and it won't be in a hospital setting. Any service provided within a hospital setting just drives the cost up because of inherent expenses within a
absolutely,
hospital structure. You know,
absolutely.
so we intend having procedure rooms, and inshallah even renal replacement services for 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 patients, and specialists will be working on in what we call an outpatient setting.
Wonderful. Again, I think you're reading my mind as you're speaking, because I was going to ask you about a dialysis center, and you've just mentioned that. But is that going to be up and running with immediate effect, or is that part of your long-term plan?
No, that's part of our long-term plan, but
Mhm.
inshallah, we hope that that can be realized within the first half of next year, inshallah.
What I'm also thinking, and perhaps that too, you guys can apply your mind to, we have a lot of retired medical health professionals in the community, and a lot of people want to give of their time, they want to volunteer their services. Would that be part of your plan going forward, that they come in and they offer free services or services at a marginal rate for the indigent in the community, your pensioners, and people who truly may be out of job, etc., out of work, don't have work? Would that be part of a plan you guys could look at?
You know, um, we've already discussed the issue. I'm not saying with you. I mean,
Yeah, yeah, I
within our
realize that.
organization.
Uh-huh.
Within our organization, regarding people who really can't afford even our affordable rates, and we in discussions to find mechanisms to fund treatment of, as you mentioned, indigent and really economically challenged people who can't even afford the uh, uh, low fees that we intend charging. And inshallah, that's a good idea to enlist the support of retired health professionals who are willing to give up some of their time, and then you only have basic expenses of buying medication and so forth. And regularly, on a regular basis, if we can provide that kind of service for the really indigent, then I think it will be a noble gesture, and it can serve as sadaqah on their part, and
Absolutely.
whoever is giving of their time and resources.
It's
I think you did
Dr.
mention
Dasu,
today about the.
it's a noble gesture anyway, even if it's going to take a while to implement that part of, voluntary medical healthcare professionals coming in and offering their services for free. But, currently as you speak, it's very noble indeed. It is truly very noble. May Allah subhanahu wa ta'ala accept all your guys' efforts. But you do want to say something else?
Yeah, I just wanted to mention that if our time is up, just about the pharmacy, because the pharmacy will be on site. There won't be a waiting period. I mean, even if you go to these chain pharmacies now or independent pharmacies, people end up waiting a long time for their medication. So the medicines will be provided immediately. The you know Everyone is busy, has commitments, and I think this will definitely contribute towards the overall functioning and effectiveness of the center.
I don't doubt that for a moment. Inshallah, all goes well. I think uh, it's just such a noble gesture, and I just think long, long, long overdue. And may you guys grow from strength to strength. The big formal opening is tomorrow, so lots of du'as for one and all. And guys, we commend you. We commend you, and we're hoping that you'll come back to us in a year or two and say, we are opening similar facilities um, in other parts of Lenasia or in other parts of the greater Gauteng province. So may you grow from strength to strength. Thank you indeed for being
I
on
mean,
the show this morning.
I mean, Jazakallah for giving us an opportunity just to discuss what we
Absolute
can
pleasure.
do and how we can provide the service.
Absolute
So
pleasure.
tomorrow it's from 9:30 to 3:30, and it's a walk-in. It's a walk-in service. And we'll try and give our best attention and service to all who are going to attend.
Okay, good on you. Assalamu alaikum, Dr. Imtiaz Dasoo and the Valley family. Allah accept all your efforts. Go well. Assalamu alaikum to you.
Ameen wa alaikum salam wa rahmatullah.